Welcome, my name is Cara. Today we will be looking into the concept of ethics and its importance within the healthcare sector. We will be utilising the case study of Mr. Peter French to help us identify the ethical issues and dilemmas which healthcare professionals often face on a day-to-day basis. The case study can be located under the heading of Clinical Decision Making Part 2 or on page 4 if you are viewing the PDF version. Firstly, we must understand what is meant by ethics and the role it plays in shaping the vital decisions made on behalf of the patients by healthcare professionals. The notion of healthcare ethics has continually played an integral role in establishing the basis of medical decision making in helping to shape what is right from wrong, as highlighted by Lowy and Lowy. Ethics is also described by Beauchamp and Childress, cited in Johnston, as the foundation of ways in which we think, understand, examine, and then determine what would be deemed as morally correct depending on the situational factors. Medical-related ethics is essentially formed upon the basis of various ethical principles including justice, veracity, fidelity, non-maleficence, beneficence, and most importantly, autonomy, as highlighted by Cramp, Forrest, and Cooper. Additionally, it should also be noted that ethics is applied and practiced through theories such as consequentialism and deontology, which are seen to help guide ethical decision-making. These theories will be explored upon shortly when discussing the case study of Mr. French. So now you might be wondering how these ethical principles are put into practice for relevant healthcare professionals. These vital ethical principles are applied in Australia through the Australian Medical Association's Code of Ethics, which embodies the ethical principles as a way to provide a standardised guide of ethical behaviour for healthcare professionals when dealing with patients, families and colleagues. Complementary to the Code of Ethics is the Code of Conduct for Registered Doctors in Australia. The Code of Conduct, formed by the Medical Board of Australia, exemplifies what is meant by good practice, whereby it is on the professional onus of the doctor to become familiar with what is meant by that good practice. The Code of Conduct sets expectations upon doctors through certain principles that portray good medical practice within the notions of ethics and professionalism. Now, nurses and in particular doctors working within healthcare have an important duty to ensure that they are practicing within the codes of ethics and codes of conduct. Although, this is not an easy task as both healthcare professionals are commonly challenged with numerous kinds of ethical dilemmas where it is often difficult to distinguish what course of action may be deemed as ethically correct. So, let's take a look into what these dilemmas frequently include. A research paper published in the Australian Journal of Advanced Nursing carried out a study to identify the most prevalent ethical issues in accordance to the results taken from nurses working in the Australian healthcare sector. It was concluded that the most ethical issues comprise of, I quote, protecting patients' rights and human dignity, providing care with possible risk to their own health, informed consent, staffing patterns that limited patient access to nursing care, the use of physical or chemical restraints, prolonging the dying process with inappropriate measures, working with unethical or impaired colleagues, caring for patients or families who are misinformed, not considering a patient's quality of life, and poor working conditions. Although it is widely recognised that nurses are frequently made to deal with these kinds of ethical issues, it should be noted that whilst these ethical issues faced may be similar for both healthcare professionals, doctors essentially have the final say in most scenarios. Therefore, doctors working within hospital environments are challenged with greater pressure to remain in line with codes of medical ethics and conduct when making vital decisions in relation to patients. So now, let's take a look at the case study and put these ethical dilemmas into a real-life perspective. The case study presented by Welly and St. Harvey involves a man by the name of Mr. Peter French, who is 62 years of age. Mr. French underwent cardiac surgery, although 2 weeks later he is still in the intensive care unit, where the medical team have been unable to take him off mechanical ventilation due to having a history of fibrotic and obstructive lung disease, among other conditions. The medical team dealing with Mr. French, which would comprise of doctors, are in disagreement regarding what course of action should be taken. Now, the ethical dilemmas being dealt with by doctors in this case relates to whether or not to withdraw Mr. French from his medical treatment, being mechanical ventilation, whilst also ensuring his autonomous rights and human dignity is respected and maintained. Further ethical dilemmas relate to whether or not keeping Mr. French dependent on mechanical ventilation will inappropriately prolong the dying process and will be inconsiderate of his quality of life and autonomous wishes. So now let's look at the views of the opposing parties in this case, comprised of Mr. French himself, the medical team and family members. It should be known that Mr. French has previously declared that he is against the use of a mechanical ventilator. On one side of the predicament, the doctors are unable to identify how to reverse the causes of Mr. French's ventilator dependency. This is then supported by Mr. French's son, who insists that the ventilator should be removed to essentially bring his life to an end now, rather than let him endure in a slow death associated with potential hypoxia. On the other side of the predicament, the doctors are arguing that as long as Mr. French is mechanically treated with a ventilator, he will remain in a stable condition. This argument is supported by Mr. French's daughter, who is against the removal of her father's ventilator as she believes he is suicidal and depressed. So, to assist in determining which course of action would be deemed as more ethically correct than the other, it is important that we draw relevance and understanding to the applicable ethical principles and theories to guide this ethical dilemma. As mentioned earlier, we will be utilising the ethical decision-making theories of deontology and consequentialism to substantiate what decisions should be made. Let's begin with the deontological theory of ethics. The name of this theory derives from Greek origin, where the deon part of the word translates to duty. This draws reference to the meaning behind the deontological theory, as highlighted by Mandel, KP, and Parija, as doctors have a duty to ensure they conduct and maintain acts that are intrinsically good, and subsequently seize any acts that create intrinsically bad outcomes for patients. If we were to view the case of Mr. French under the viewpoint of the deontological theory, this would involve doctors opting to not fulfill the patient's wishes to have his ventilator removed. This resonates with the fact that if doctors keep Mr. French on ventilation, his life will therefore be prolonged, while simultaneously ensuring that by nature of the deontological theory, their duty to maintain an intrinsically good act is upheld. In support of this theory, the meaning of the ethical principle non-maleficence, illustrated by authors Liu and Zhang, provides that doctors have the utmost responsibility to ensure their actions avoid bringing about harm to Mr. French. In addition to this, the ethical principle of beneficence infers that doctors, along with all other healthcare professionals, are obligated to ensure their acts in dealing with Mr. French are of benefit only, whereby any harm is avoided, according to Summers and Morrison. However, if doctors decide to keep Mr. French on mechanical ventilation in order to prolong his life through the ethical mindset of avoiding harm at all costs, the patient's wishes to withdraw from treatment will ultimately be disrespected, subsequently impeding on his personal autonomy. In contrast to the deontological theory, the consequentialist theory stipulates that if an outcome of an act promotes ethical apprehensions by leading to harm, it can actually be regarded as the correct course of action, given that the outcome is of benefit to a majority of individuals, according to Manziel, KP, and Parija. A consequentialist perspective would implicate that in the case of Mr. French, doctors would agree to withdraw his treatment of mechanical ventilation, even if it will result in his death. In doing so, doctors would be acting in line with the imperative ethical principle of autonomy, which provides that patients should be capable of making their own medically related decisions, according to Liu and Zhang. Therefore, Mr. French's autonomous decision to have the ventilator removed will not be violated. Additionally, the ethical principle of non-maleficence can also be applied through the consequentialist theory, which likewise supports the removal of Mr. French's ventilation to avoid harm and potentially a slow death associated with hypoxia. This corroborates with the notion that Mr. French's treatment through mechanical ventilation has become futile rather than medically indicated, as it has the potential to create more harm than good and is only exacerbating his suffering. As highlighted by Welly and Tenharvey, a treatment is deemed as medically indicated when it is seen to be of substantial benefit to a patient. On the other hand, when a treatment is deemed as futile, this means that it is not seen to be of benefit or lead to an improvement in a patient's current condition. Therefore, Mr. French's medical treatment through mechanical ventilation may initially have begun as a medically indicated treatment. It is now creating more of an issue for the patient as he has become irreversibly dependent on it, so this would substantiate enough reasoning for the treatment being withdrawn due to its futility. It should also be noted that although Mr. French's autonomous decision to withdraw from treatment would inevitably result in his death, this would not be on the onus of the doctor or supporting health professionals. According to the Australian Human Rights Commission, Mr. French's death can be viewed in a way that would constitute what we call passive voluntary euthanasia, whereby the patient voluntarily makes the decision to withdraw or withhold from life-sustaining treatment, which would allow for their health condition or disease to take its natural course of deteriorating progression. Lastly, linking back to the core notion of the consequentialist theory in conjunction with the ethical principle of justice, it should be reminded that both concepts support that an act is deemed as good or fair if it benefits a majority of people. Therefore, doctors should work to be mindful of available resources such as ICU beds or mechanical ventilators in this case, and to maximise resources in a way that would benefit patients on a larger scale, and in other words, for patients whom of which would be of greater benefit to relevant treatment equipment. In doing so, this removes treatment that may be futile for some and makes more available resources for those whereby the treatment would be medically indicated and of greater benefit to them. So now that we have deconstructed the opposing courses of action, with that being whether or not to take a deontological or consequentialist approach to this ethical dilemma, it should be clear to see which perspective outweighs the other. With relevance to the decision made in the case study, it appears as though doctors came to the conclusion that they are simply not able to continue treating Mr. French without his consent, particularly given the fact that he is not diagnosed to be medically incompetent or swayed by clinical depression. Doctors may face serious implications, such as being charged with battery, if they continue to treat Mr. French through mechanical ventilation against his autonomous and sound-minded decision to withdraw treatment. In taking this course of action to solve this ethical dilemma, doctors will be following the consequentialist view, which will ultimately benefit the greater community. This widely seen benefit would be a result of Mr. French's wishes and personal autonomy to make his own medically informed decisions being respected, whilst also being mindful of maximising the availability of medical equipment and intensive care unit beds. I hope this presentation has given you a good understanding of ethics and the vital importance it plays within the healthcare system when it comes to dealing with ethical dilemmas. Thank you for your time and listening.